Hello, everyone. Thank you so much for joining us today. I am Ruma. I'm a health and fitness coach, and I'm the founder of Navitai. And today we have Dr. Ananthraman. He is a consultant endocrinologist in Magna Center Clinics in Bangalore. And we have him today to discuss a very important issue among women, important and a common issue among women, which is PCOS. So, Dr. Ananthraman, thank you so much. Welcome to our program. And thank you so much for taking the time out to share your knowledge with our community.
Thank you. Thank you, Ruma. And I'm also a proud part of Navite family, and Ruma is my coach, actually. So, so thanks for having me over here.
Thank you so much, Doctor. And thank you so much for your trust in our services. Thank you once again. It has been a lovely relationship. And Doctor, so today we want to discuss PCOS with you. We have a lot of women in our community who want to know about this issue, as well as want to have more knowledge and information around dealing with PCOS. So if you can help our community understand what is PCOS, we can start from there.
Yeah, you can shoot away. Yeah.
Absolutely. So, Doctor, the first question is, what is PCOS?
So, PCOS is an acronym. It stands for Polycystic Ovarian Syndrome. So it's by definition, how does it happen or why does it happen? It happens because it's a genetic disorder. So all of us are born with a set of genes, and many of these genes are not perfect actually. So we can call these are small manufacturing defects. So whenever a vehicle leaves a factory or a machine leaves the factory, you can have small manufacturing defects, right? All of us have slight manufacturing defects. So, there are certain genetic anomalies which are decided at birth, because of which we have a certain tendency actually. So that is the cause, that is the root cause of PCOS. Why do we know this? It's because, irrespective of the country in which you are, your ethnicity, the PCOS rates are all similar. So whether you are Caucasian, whether you are Black, whether you are South Asian, East Asian. So when you look at different ethnicities and different countries, you find that the prevalence of PCOS, of this disorder called PCOS, what we understand as PCOS is similar. So it's somewhere between 5 to 10%. Of course, wherever the prevalence of obesity is higher, it tends to go up a little bit. Mm-hmm. But more or less, it is at that level of 5 to 10%, and it is unremitting. It keeps on being there throughout life, actually.
I see.
So this is PCOS in general. It's a genetic disorder which leads to certain hormonal problems and reproductive difficulty. In addition to that, some metabolic problems also. So what is a metabolic problem? So metabolism is what it refers to the way we take in our energy and burn our energy actually. Some may be not having a very good metabolism, some may have a very hyper metabolism. So it's a disorder of metabolism also. I mean, that is also decided at birth, so when we are born, basically.
All right, doctor, so that is a great explanation. It is genetic, and since it is genetic, we are born with those genes, it is oftentimes probably difficult to reverse it. And we will come to those issues also. Now, oftentimes I also get some questions, doctor, is it reversible? No, not reversible, I'm sorry. What I get is how to recognize recognize whether I have PCOS or not. Oftentimes, women, who are missing their periods, they have a question: oh, is it because of PCOS? How would a woman understand whether she has PCOS or not?
That's the crux of of today's meeting. How do you recognize whether you have PCOS? So for this, there are three things actually. So there are diagnostic criteria for PCOS. So one is hyperandrogenism or excess androgen production in women. So both men and women have androgen or testosterone basically. So in fact, the estrogen in the body is actually produced from testosterone. It's only one methyl group. You must have testosterone, and the testosterone, the methyl group is removed from testosterone. It's called aromatization. So once aromatization happens, it's in biochemistry. So once the testosterone is aromatized, it becomes estrogen. Okay. So this is what happens when you want to produce estrogen. So it is not possible for a woman to have estrogen without having testosterone in the body, right? So what happens is that the testosterone slightly increases when compared to what is usually normal for most other women. Say, for example, if you take the median level of testosterone in women who are having regular cycles, who are otherwise normal, healthy women, it's around 30 nanogram per deciliter. So that is the amount of testosterone that is there in women. So if this value goes up slightly, even if it is 50 or 60, it may not be very high. So that can cause certain problems. So namely, abnormal hair growth, acne. Acne is something that happens throughout life actually, and various other triggers are there apart from androgens, of course, and also hair growth. Hair growth, again, hair growth also does not depend only on testosterone. It again depends on the sensitivity of the hair follicle. Like, for example, if you take Japanese women or Chinese women, East Asian women, even if they have high androgen levels, they do not have so much of hair growth on the face and chin. So it's your general tendency to form hair also is important actually. So it's a mixture of things actually. So we recognize that the girl may be having PCOS if we find a tendency to form excess body hair or have excess breakouts. Okay. So this is one way of recognizing. It's called hyperandrogenism. This is one way. This is one pillar. The other pillar is irregular cycles actually. So usually what happens is that a woman who's 3 years or 4 years following menarche. I mean, the first 3 years of menarche, always there is menstrual irregularity because the reproductive axis itself is not matured actually. And why does menses happen? We need to know. Menses happen every month because there is something called ovulation. A woman produces the egg every month once. So 14 days after ovulation, there is menses. So the gap between the ovulation and menses is fixed. Okay. So once there is ovulation, 14 days later, there has to be menstruation. So if there is no ovulation, there is no menstruation. Okay. So, basically, for the first 3 years after menarche, that is after having the first period, so there can be some irregularity. So, it's basically, a maturing reproductive system. So once the 3 years are over, we expect a woman to have menses at least 11 cycles or 10 cycles a year. 10 cycles. If you take a span of a whole year, so, we expect 11 or 10 cycles. So you can miss up to 2 cycles in a year. So anything less than this is considered oligomenorrhea. Okay. So how do we recognize it in a run rate situation? No, you don't know. You don't have to wait for 1 year. So, but if you find that the cycle length is beyond 35 days, that the gap between the first day of your one cycle and the first day of the next cycle is more than 35 days, you call this oligomenorrhea. And if you see that it's happening repeatedly, you know that definitely it is a oligomenorrhea. So if it's more than 35 days, you are not going to have 10 cycles in the year actually.
Correct.
35 to 10 is 350 already. 10 months or 10 cycles are over. It is less than 10 cycles. So basically, this is how we make a diagnosis. So sometimes it may take a little longer to make a diagnosis. So in the first 3 years of life, it's very difficult to recognize PCOS actually. So above the age of 18 years, if you have persistent cycle abnormalities, then we call it PCOS actually. And there is another way to diagnose PCOS. I'm sure all of our listeners are aware, which is basically ultrasound. So we can do ultrasound. And what kind of ultrasound to get? So there is a lot of over-diagnosis using ultrasound. See, what has happened is now the ultrasounds are much more sensitive than the ultrasounds that used to be there in the 70s. Not 70s, there was no ultrasound. 80s only it came. In the 90s and 2000s, so the ultrasounds are much more sensitive. So almost every ultrasound now shows that there is a polycystic ovary pattern. So what is this polycystic ovary pattern? So it's a pattern wherein the ovary is a little larger, okay, and it has got multiple follicles in the surrounding. So we need, if there are more than about 10 follicles, we consider this a polycystic ovary. Ideally, So we need to do a transvaginal ultrasound, not a transabdominal ultrasound.
Got it.
So there is a probe which is using a transvaginal probe through the vagina. The probe is used, and in that we need to calculate the follicle number per ovary, FNPO. So ideally, that's the best way to diagnose. That's the most sensitive and specific way. And the number of follicles that are required is actually increased actually. Okay. So over the years, because now the ultrasounds have become very sensitive, no? So just like our cameras have become more higher megapixel camera, no? So our ultrasounds have also become very sensitive. Those, they pick up very, very small this thing. So there is a little bit of overdiagnosis on ultrasound that happens. So even by the older criteria, even by the older generation ultrasounds, around 30% of women used to have polycystic ovary. Okay. So if you have already gone through an ultrasound and the ultrasound is reported as polycystic ovary, don't panic, because almost 50% of women it is polycystic ovary. Okay. Yeah. So basically, it has rendered it impossible for us to diagnose using the ultrasound. So I don't give much importance to ultrasound now as an endocrinologist, but that gives me a lot more. I give a lot more importance to the history. How the patient has come, what is the cycle pattern, okay, from when the cycle pattern is abnormal, and also the what is the duration and the kind of hyperandrogenism that is there. So basically, for me, if a patient comes to me, I can make a diagnosis of PCOM by just talking to her. That's all. I mean, I just don't need any blood tests to diagnose PCOS. We do recommend blood tests. But the blood tests are to rule out other problems, basically.
All right.
So some other disorders can mimic PCOS. Like, for example, if you have hypothyroidism, like, for example, if your TSH is high and is unrecognized, then again, you can have irregular cycles.
Exactly.
That can be caught easily. So you can do a blood test and find out. You can also do have certain other rarer endocrine disorders. There is a disorder called congenital adrenal hyperplasia, non-classical CAH. So where you can have irregular cycles, excess androgen, and a polycystic ovarian morphology. But it is a single gene disorder. It is not a multi-gene disorder, and it's a more severe variant actually. So gross hyperandrogenism, their hair growth will start at 9 years or 10 years of age, and there'll be heavy this thing, but that can be recognized by measuring a hormone. So, but usually I will pick them up clinically, basically. So, and very rare endocrine disorders like Cushing syndrome, acromegaly, these all can be also this thing, but these are 1 in a million. I mean, unlikely that, you will be having it. I mean, very, very less chances that you will be having it. So if you have prolonged cycles or more than 35-day cycles and you have abnormal hair growth or acne, then you should worry about PCOS. Okay. And ultrasound is not the way to diagnose PCOS. The best way to diagnose PCOS is to meet a doctor. Then the doctor will decide whether you need an ultrasound. Okay. So usually what happens is, now the patients go to the sonologist, get the ultrasound done, and the ultrasound says there is PCOS, and the patient is very worried that they have PCOS. Actually, they may be absolutely not having a little bit of hair growth or acne also, and have regular cycles. They'll be absolutely normal, but it's a polycystic ovarian morphology. So ideally, we need 2 out of these 3. So we have got polycystic ovarian morphology, we have excess androgen, we have irregular cycles. 3 things are there. Out of 3, we need 2 to diagnose PCOS. Right. 1 alone is not enough.
Got it. Understand. That's a lovely explanation, doctor. So to sum it up, you're saying that, polycystic ovary syndrome is genetically driven. And also in the first 3 years of getting our menstrual cycle, when the girls first get the menstrual cycle, the irregular periods is not just the only way of diagnosis. The other things are hyperandrogenism, and that has to be understood. And second is ultrasound is also a way to find out whether there is to count the number of follicles and identify. Now, the ultrasound may not be the right way of going about it, because there can be an overdiagnosis. Even if the girl or the woman does not have PCOS, it can still say the results to be positive. Yes, that is not an ideal way. So the best recommendation is, if you are worried that you may have PCOS and you are missing your periods, you have hair overgrowth, then best is to meet with your doctor and rule out other conditions that can also give you the same kind of symptoms, like hypothyroidism can also lead to missing periods, and your doctor will be able to rule out other possibilities and then fix whether it is PCOS or not. All right. So great, doctor. Thank you so much. Now, you also mentioned that in the first 3 years, it is difficult to, irregular periods is common, right? Because the reproductive system is stabilizing, the hormones are stabilizing, all of that. Now, how would you say, that was just the first 3 years, but from the time a girl gets her first period to a time a woman stops getting her period, what is the journey of PCOS through this life cycle?
Like I mentioned, so once you have PCOS, you are likely to have, troubles throughout your life, reproductive life rather. So reproductive life more or less, comes to a sunset around 50 years of age when you enter menopause actually. So starting from 13 years of age when you get menarche. So this is the entire duration, say around 35-40 years of duration is the approximate duration. It can be a little lesser if you get an earlier menopause. So this is the entire duration. So in the journey, so there are many things that could happen actually. So first thing that you'll notice is that, as you are getting menarche, you will start noticing that, like other girls who are getting their cycles regularly, you are not getting the cycles regularly. Okay. And along with that, along with the cycle irregularity, you start around 50% of women experience difficulty with their metabolism. What is the difficulty in the metabolism? They are putting on weight easily. And when they try to lose weight also, the weight doesn't go down. Okay. So, and, they are stress prone, like, even if they get stressed out, if they sit for exams or something like that, at that time, they gain weight a little bit. Okay. And they can have also a lot of cosmetic issues related to two things. One is the high androgens in the body. So where you get excess hair growth and acne. And this can be coming and going. It need not be there all the time. So especially acne keeps coming and going all through. I mean, you'll be surprised that, women as old as 40 or 45 can have acne actually. And it doesn't die down at all. It just keeps on going. So, and the hair growth is something progressive. And usually what happens is that, most women, almost 70-80% of women have got significant hair growth by the time they are 25 years of age. Okay. So a small number will have aggressive hair growth starting 13-14 years of age by the time they are 20 only. But a larger number will if you take the entire 100 girls with PCOS, by the time they are 25 or 26, they can have significant hair growth. Okay. So this is one problem which is troubling, which is the visible problem of PCOS. Okay. The tendency to gain weight, the tendency to gain weight in response to stress, and the cosmetic issues because of the high androgens. Fourth one that can happen is insulin resistance. So PCOS is very closely related to insulin resistance, though not all PCOS is insulin resistant and not all insulin resistance is PCOS. So you can have insulin resistance. You tend to have high insulin levels in the body, and that insulin level kind of blackens the skin around your neck. Okay. So, and also, skin on the forehead, skin underneath the eyes. So you can have a lot of cosmetic issues. Okay. But the cosmetic issues can all be handled easily. So I'll come to that a little later. So I was telling about these cosmetic issues. This is the cosmetic issues that you can face throughout life. Hair thinning is also, again, another cosmetic issue that can come up. Okay. So, but hair thinning again depends on parental history of balding and all that. Like if you have a father who's having balding and you also have PCOS, then the chances are that you start losing hair much more easily. So when you combine all the genes for baldness, the gene for PCOS, you get a result where the hair thinning can start as early as in your 20s and early 30s also. Okay, so this is the cosmetic concern. Second one is the problem with the menses actually. So if you get very delayed cycles, if you don't get ovulation, you menstruate once in 40 days or so, you can have heavy bleeding. Okay. So you can have heavy bleeding, and that heavy bleeding can be very troublesome, especially in girls, especially in the 12 to 20 years age group, is when it's very difficult for us to handle the bleeding actually. So they have school, they have this thing, and then they are not used to it also, and they find it very difficult to handle. And usually what happens is, by the time, we have to give medication. I mean, that's the only way to control the excess bleeding. Okay. So this is one manifestation. Problem between 20 and 25 and 35 is the time of conception actually. So during conception, there can be problem with ovulation, the egg not releasing, right? So if the egg is not released, you are not going to conceive. Okay. So but then there is a solution for each of these problems. But unfortunately, there is no cure for PCOS, but there is a solution for each of these problems. For the cosmetic concerns, there is a solution. For the abnormal bleeding, there is a solution. For the non-ovulation, there is a solution. It will be interesting to note that many girls are worried about their fertility in the future, right? So they are not getting periods and all that. They may feel that they may not want to get married. When they are 20, they think like that. Many people think like that. I may never have a baby when I get married, which is not true. Because we have had treatment from as early as 1960, not now, almost 50 years back. Treatment for PCOS is there, and it is available readily. Okay, so if you give a ovulation induction agent, the success rate is very high, it's almost 80 to 85% success rate over a period of a year. I mean, in one cycle it may not happen, in 2 cycles it will not happen, but over a period of a year, you are likely to conceive. Actually, most women with PCOS, we are able to make them ovulate and have a baby over a period of 1 or 2 years of treatment. Okay. So irrespective of what exercise or diet they may do, if they do exercise diet, obviously it makes it easier, but even without anything also, so in general, it's possible to get them to ovulate. So the thing is, they should not lose heart thinking that, this is a, very negative mindset that comes. Right. So once you're diagnosed with PCOS, somebody tells them, you can't have a baby, so you will not lose weight. So you will not, it's not an absolute actually. The genes make it difficult for you to do things, but they don't make it impossible. And so lifestyle with medication will definitely get you to succeed.
Wonderful, doctor. And that's a big ray of hope for many women who worry about fertility with PCOS, because yes, it becomes difficult for them to conceive, and they would also want to understand, if there is a solution for that. So thank you so much for that hope, doctor. Then I'm coming to postmenopause. How does PCOS manifest in postmenopausal women?
In postmenopausal women, basically the ovary is quiet. I mean, there's no menses at all, so there's no menstrual irregularity. But the hair growth that has happened over the years can get maintained, because even the androgen production in the post PCOS ovary is extreme. That's one thing. Another thing is that the same set of genes that cause PCOS also cause abnormal metabolism. Okay, so and abnormal metabolism is a risk factor for heart attacks and strokes and for diabetes. Okay, so if you take a lady with PCOS itself is an independent risk factor for so many things like diabetes, heart attacks, strokes, and all that. In general, women are healthy well into their 60s. Why? Because first of all, they don't smoke. That's the most important this thing. But second of all, they are also protected by the estrogen. Okay, men start getting heart attacks and strokes as early as 40 to 50 years. Women generally don't get. Even between 40 and 50 years, it's much lesser in women. But if you have PCOS, it increases your risk almost to half of that of the men actually. So the risk becomes very high. So you need to be very, very careful with your lifestyle. Do your diet, exercise properly, get yourself screened annually. Okay, for cholesterol, blood sugar, blood pressure. So treat all of these things. So, but this cardiovascular risk can be reduced by almost 50 to 60% with medication as well as lifestyle. This can also be treated. So this stage is actually the most important, because the life and death ka matter hai.
Yes,
okay.
Yes.
So once you get a heart attack or a MI, and then you go into heart failure actually within a few years. So this is the period in which if you have had PCOS, you need to be very careful with your health and take care for the future. Since it's a lifelong disease, we need to fight lifelong. That's all.
Right.
We have the knowledge now. Earlier, these things were not very clear. See, 30 years ago, we didn't have clarity regarding all these things. Slowly, we are getting clarity.
Absolutely. And you're right on, doctor, when you say it's a lifelong thing that we will have to work with, then there has to be some lifestyle changes as well. And that is where, we also help many women with PCOS, where we focus on primarily three things. One is our strategy is primarily, as you rightly mentioned, stress level, insulin level, and anti-inflammatory, right? Anti-inflammatory treatment. So cortisol is one that we look at, insulin levels is another that we look at, and third is to put the person on anti-inflammatory diet or nutrition or through exercises, how we can decrease the inflammation in the body. And we take care of it with, with nutrition, one, exercise, another, and third is stress management. All of this really work well. They are able to, with the medication, along with lifestyle, many women have been able to see a lot of difference in their overall body weight. They have been able to reduce their body weight as well. They were struggling before, but with the lifestyle changes along with medical intervention, they have been able to do very well. So I think, I completely agree to your point where you say that we have to manage it with lifestyle. And anything else you would like to add for the women who are suffering from PCOS? Any last word? I have asked you all the questions that
I want to ask you one question. I mean, sure. I want to make a point and then I'll ask you one question also. So the point I want to make is that PCOS is not only about obesity, it's about metabolism. Okay? So it's not that, we don't focus only on weight loss, but the quality of the weight also matters. So that's when, that's where I find, Navite has a huge role to play. So I feel that, my comment will be that, I'm now asking many of my patients with PCOS, especially lean PCOS. So lean means BMI less than 25, but they may be metabolically obese. Lean, but metabolically obese. Because what happens is that their truncal obesity may be more or their visceral obesity may be more. So these all individuals do require strength training. At its core, strength training is the most valuable input that you can give. And of course, the diet is very important. Diet, nothing moves without diet, actually. Diet and strength training. So you're doing a wonderful job. And I feel that, and another thing is, how long, you want to retain your clients. I mean, I feel that you should retain your clients for lifelong if they have PCOS.
Yes, no, absolutely, doctor. And that's a great point that you made. Absolutely. Strength training is very, though there is a lot of research that is available for women to do strength training, it is more important for women. Men also need it, but it is very, very important for women to do strength training for many reasons. One is, PCOS, women who are suffering from PCOS, and also women post-menopause. Our bones are anyway thinner and smaller than a man's bone. And after menopause, because we do not have the support of estrogen, they become more thin and brittle, and we are at a risk of osteoporosis. Close to 200 million women worldwide are suffering from osteoporosis today. So that is also a risk that women are at. However, though we need it the most, women are more negligent about strength training because of that. When I speak with people, with patients, with customers, my clients, I find out that there are two primary reasons why women do not want to do strength training. One is they feel that they'll become very muscular and they'll start looking like a man. They think that they'll become Salman Khan. Okay. And second is the fear is that, women do not want to go to the gym or to public places to do exercises. Many women want privacy and safety to do exercise. So my message to them is one, and doctor, you will also have to give your inputs in that, is women will not, because we do not have testosterone, because we do not have that that hormone, we will never end up looking like a man. That is not in our hormonal system itself. So we will build muscular strength, we will build the muscles which will give support to our bones and joints, but we will not become like Salman Khan. And second is, it is not necessary that women go to gym to exercise. It is not necessary. And you will be able to provide your inputs there as well, doctor, that strength training, we can use our body weight to remain strong inside the homes, in the privacy and safety of our home. Yeah, so I'll take a pause here, and
I'll
I'd
vouch.
like to hear your
I'm
comments.
I'm your client, so I can tell you. I mean, I never had to step outside my house for the last 1 year to do my exercises. Okay, yeah. So only because my house is small, or my wife has decorated the house so well that there are a lot of furniture. So I'll have to. No, there is no. I mean, if I do a plank walk or something like that, only then I need I don't have the space in my house. I'm not going to. But anyway, there is a place outside, so I just go outside and do it in the fresh air. That's all. Right. So that is my take on that. And another thing is, what you're saying is 100%, 100% right. So you would have seen this this headline coming in Times of India that 80% of births are cesarean sections. Okay. So why is this happening? Because girls from the age of 10 or 12, I'm not able to get my own daughter to go and do exercise. Okay. So because girls don't socially, they are not going out and doing any exercise. Okay. So see, one, we have talked about the influence of genes. What about the influence of culture? Okay. So there is no culture of doing exercise among girls in general, actually. So boys also say they do something, except for girls who go into sports competitively, which is a small percentage. So in general, girls don't socialize in the playground from the time, they say for girls, the puberty starts at somewhere around say 9 or 10 years of age. After that, girls don't interact so much with younger girls. So till that age, till 8 years or 9 years old, they're very active. They go outside and play and all that. After that, the exercise kind of dips completely. So when it comes to boys, it's maintained for a little longer till they go to their 12th standard or whatever. But for girls, it's very, very low. And this is a matter of major concern. So by the time they are 24, they have done no exercise whatsoever. And they have got no physical fitness, actually. This is the reason. I feel this is the main reason why there are cesarean sections are very high, actually. Because you need to have, see, I can't see anybody giving birth to a baby which is 2.5, 3 kilos when you can't do a 100-meter dash. So it's very difficult. Okay, so unless you're used to doing, and especially in the the rich and upper middle class society of India, the physical activity has come to naught, basically. It's nothing. I mean, zero.
Totally. Yes. Absolutely, doctor. And I completely agree with you. And I think you brought up a very, though it is not related to PCOS, but you brought up a very important and a significant point that, through pregnancy also, a woman needs to maintain her health and fitness levels. Many women are actually scared to exercise during 2 times. One is when they're having their periods, and second is when they are pregnant. And I tell them that it is important, if your body permits you, if you do not have severe cramps, you're not in pain, then you can exercise. But if you're in severe cramp and you're in pain, you should not exercise. And then during pregnancy also, and I have given birth to 2 children, normal delivery, and I have throughout till the last day that I delivered, and right after my pregnancy, within 6 weeks, as soon as the doctor gave a green signal, I started exercising again. So the thought is that a woman can exercise through her pregnant period as well, but the exercises are different because her center of gravity has changed in her body, and her there is change in the lumbar spine and that area as well. So there has to be certain changes in the exercise, but it is completely safe for women to exercise through pregnancy as well as during period. So you brought up a very good point, doctor, because if women start doing that, there will be much lesser chances of.
I would also recommend exercising for pregnant women, especially when pregnancies have started going, basically by the time you conceive, you're already 28 or 30, and you have not done much of exercise throughout your pre-pregnancy period. Pregnancy is the time at which something called the gestational diabetes also starts. Okay, so once you're pregnant, and if you have fairly, if you're just going to if you're going to plan pregnancy, or you're going to be thinking of pregnancy the next year, this is the time in which you need to get into fitness, basically, so that you can manage to have a healthy baby vaginal delivery. I mean, so if you build good muscle strength, then it's possible to this thing. So I mean, I don't think there should be any problem at all. I mean, it's very, very essential. Most of the things can be solved through lifestyle, I feel. About 80% of PCOS related problems can be solved only through Ruma and diet advice or this thing. But the problem is the behavior has to be sustained. So you can't do it for 6 months and then leave it. Actually, it doesn't work.
Yes, and that is right, and it has to be sustained. The exercises also many people do. They think that they can do the same exercises and that will serve them for the rest of their life. But the body gets used to that stimulus, and then it does not operate beyond that. So if we have to constantly keep ourselves healthier and fit, the exercise pattern changes as well. So it is not the same set of exercise that people continue to do. And we also tell people that, as you rightly said, it is not just about weight loss. It is also about weight loss healthfully. And we talk about 5 pillars of holistic health, which leads to weight loss as well. One is nutrition, the right balanced nutrition. But for PCOS related women, for women who are going through PCOS, a little different kind of nutrition is needed. We give them a higher level of plant-based fats, like fats that are coming from seeds and nuts. They are anti-inflammatory with omega-3 fatty acids and anti-inflammatory, and that helps to work with their symptoms better. So that is the nutrition part of it, and higher levels of protein, which also fats and proteins are what is making our hormones. So whenever we are working with hormonal issues, the fat and the quality of fat and protein matters a lot. That is one strategy we take. Exercise, strength training, because that also helps to increase the sugar uptake in the cells and thereby reducing the insulin levels. Stress, sleep, and hydration. These are the 5 pillars of holistic health, and that is what we do. Whether it is PCOS, strategies will be different, and any other condition strategies will be different. But these are the 5 pillars that we have to follow for the rest of the life, and that is also that we help people with.
See, people ask, why should I have a lifestyle coach? So what I tell them is that even a tennis player, even a top-ranking tennis player needs a coach. Okay, why does he need a coach? He's already winning the Wimbledon, right? I mean, he can definitely coach the coach. So, but then the thing is, we all need someone to watch over what we do and, give some push here and there, I mean, some guidance is required. A coach is very essential, I believe, for a disease which is lifelong, or we'll end up paying for it by taking medication. The scope of medical intervention itself is limited, or for that matter, any intervention. So we can't say that, by exercising also we can make you live to be 200. So it's just a question of 2 things. One is increasing the quantity of life and the quality of life. I believe that definitely, I mean, without a doubt, doing exercise and sticking to a very healthy diet improves the quality of life. There's definitely no doubt about that. Quantity of life, there are compelling arguments that it will definitely contribute. Okay, because once the quality of life improves, you will have probably more zest for life, basically. So you want to live longer, okay, because the quality is good, right? So so there is no point in living 10 years of a painful life, actually. So if there is severe pain in the body, you are not fit, you're finding it difficult to get up and walk. So these are all the things, actually. So many of my patients with diabetes, with chronic diseases, they have a poor quality of life, which we are not able to address using our medication. So most of the time when they come, a woman with PCOS will come and tell that, no, I'm very irritable, I'm sleepy, I'm tired all the time, I don't know what to do, I'm stressed out, okay, and I'm not able to reduce weight, I'm not able to this thing. So exercise is the drug that, solves the quality of life problem. The quantity of life problem also it may solve, but we really don't have so much of proof, actually. We have proof that it delays the onset of diabetes. We have proof that when you exercise early on, it reduces the risk of heart attacks and strokes. We have descriptive epidemiology. We don't have scientific proof that it works, but I'm very confident that it actually works in reducing. But so what? I mean, at least let us have a good quality of life while we are here.
Absolutely, doctor. I'm totally with you on that. Great. Doctor, thank you so much for your time. It was a great conversation, lot of value add, and I'm sure our community of women will gain a lot from the knowledge that you have shared today. And thank you to my audience as well who joined in to listen to this talk conversation with Dr. Ananthraman. And if you or any of your family members is struggling through PCOS and need consultation, then Dr. Ananthraman is available at Magna Clinic in Bangalore, and his details I will share down shared below this video. So please get in touch with Dr. Ananthraman and get your questions and get yourself checked through Dr. Ananthraman. Thank you once again for watching us.
Thank you.